There have been numerous cases of outbreaks happening in these homes, including the Participation House in Markham, Ontario, which I mentioned earlier, where reportedly staff walked out when they found out that there were a number of positive cases in that home. Laura Meffen made the call to pull her daughter Emily out of the residence earlier this week due to an outbreak. Participation House is a facility for adults with disabilities. However, Emily has developed a fever and she may in fact be sick. These are some of the tweets that led us to this story. Laura is now concerned she won't be able to provide the care her daughter needs for long. And Laura and Emily join us now from Markham, Ontario. Hello.
Hi, how are you?
Good, how are you? Hi, Emily. Good to see you both.
You say hi.
Hi, Emily. Laura, how did you, I guess, tell me how you got here. You decided that there was no choice for you but to pull Emily out.
Yeah, so on Tuesday, we got notification that there was a possible outbreak with a cough, a fever, and a runny nose. So we made the decision, our family made the decision to take Emily out of Participation House so that we could hopefully, so she wouldn't get COVID. And if she did, then we could care for her one-on-one.
And how difficult a decision was that for you? Because I imagine Emily had her life is all in largely in the house. She's got a routine there, and it means that you have to take on all that care now.
Yeah, like our house, Emily's been living at Participation House for 2 years, and the reason why she moved in there was it was getting harder and harder for us to physically take care of her. So it was a hard decision, but it was also an easy decision. Like we had to do it for Emily, and that was just it. But we don't have all the equipment and the care for her. Right now, I'm isolating upstairs and with Emily by myself. So I'm doing the care one-on-one for 24 hours.
And were you working before that? Have you had to take a leave in order to pick up all this additional care for your daughter?
No, I've always been staying at home with Emily, just because of the nature of her disease. What I have been doing is a lot of volunteering. I do a lot of volunteering in the community, at the city of Markham, at our children's treatment center, in our local school as well.
So you do have some concerns. I guess Emily had a bit of a fever. I don't know if she's displaying any other symptoms. What do you think is going on right now in terms of her health?
So when we brought Emily out on Tuesday, she actually had a fever, or a low-grade fever of 37.5. And with Emily, she rarely ever gets sick. So for her to have a fever, even just a slight temperature, means that something is going on with her. So she had the fever Tuesday and Wednesday morning. I gave her some Tylenol Wednesday. She fell asleep and woke up, and then she was fine. So I was just thinking, oh, it's just a cold. It was just a cold. And Wednesday and Thursday, she seemed fine. But then Thursday night in the morning at like 2:30 in the morning, she started screaming out with a lot of pain. At first, I thought she might be having a seizure. I gave her seizure medication. That didn't stop. I was just so worried. I didn't know what I should do, where I should go. And we just kind of wrote it out. And then around 6:30 in the morning, she fell asleep. And then when she woke up, she didn't have a fever and she was fine. And then we found out in the morning that Participation House was confirmed with COVID, and in talking to Participation House and telling them Emily's symptoms, they agreed that Emily most likely does have COVID.
So from what I understand, there were about 10 residents there that had COVID and 2 staff members. What do you know about what happened when staff were informed around that? Did people say they didn't want to work there? What was the consequence of that?
I don't know the specifics, but what I heard from one of the senior staff was that they had the meeting and they had to tell the staff, and then by the time the end of the meeting, it was the staff, the other staff just started leaving, and just some were in tears, some were in shock. They just all up and left, except for I think two staff member, other than the senior administration team, left, and I think there was about 6 to 8 staff having to take care of 42, I guess if Emily's out, 41 residents there, and you need two staff members to take care of Emily, to lift her and transfer her. So there's that you need a lot of staff. It's just, they were the ones that were there. One nurse was working over 24 hours and she was exhausted, and then she was starting to make mistakes. And it's not fair on them. Like, they were not given enough equipment, protection, staffing. They were just pretty much left to their own to deal with this crisis with these vulnerable people.
And how is Emily doing now? Or are you just supposed to assume she has COVID-19 and hope it doesn't get worse? Or what advice are you being given?
I'm not being given any advice at this point in time. I contacted telehealth. I have a scheduled meeting to talk to a nurse on Sunday, April 12th at 10 p.m. to 1 a.m. So I haven't been able to do that. Public health, I had called, and they are on holidays. The doctor at Participation House, I wanted to talk to her, and unfortunately, she will not allow parents to contact her on their own. So I don't have any contact with Emily's family physician. So we're in no man's land right now. We don't have any help. No one is offering to give us any guidance whatsoever.
How is Emily doing? Is the fever gone? Any other symptoms, or is she doing okay right now?
She's doing okay. It fluctuates.
Yeah.
Like right now, she doesn't have a fever. And then all of a sudden, like in the afternoon, she seems to be spiking the fever. At night, she seems to get more pain. I am trying to do the regimen consistently of Tylenol, and I've been crushing the Tylenol and giving it to her. The worst is if I have to be with her at night just to make sure she doesn't have a seizure, because when she does get tired or her temperature goes up, she is potential for a seizure.
So I don't know how long you can do this. If you're telling me that normally Emily has 2 support workers with her, obviously you'll do whatever it takes for your daughter, but what do you need? What do you need the government to hear, whether it be the provincial government or federal government, in terms of what you need for help here?
The first thing would be is to have testing. Like, I'm just going on the assumption that she has it. So we need testing, but I can't go out and get tested because Emily can't. To get her tested, I have to expose my husband and my son to this in order to get her downstairs. Even I can't go and get tested, because if I do, I can't leave Emily by herself.
Right.
So we're stuck upstairs here. There's other people, other populations that are in the same boat. Yep. I've also been told that Emily has a fever of 37.5. That's not a fever. She won't get tested, even though she's been in a long-term care facility that has confirmed cases of COVID, and that's just not right. The other thing is that we need the long-term care facilities like Participation House. We need to have the PPEs there constantly. Like, they're going to get sick. The staff are going to get sick. They're going to get sick they're going to spread it to the other vulnerable population, because we need, you need the face mask, because there's going to be saliva, there's going to be germs sending right into your face, and a mask, like a face mask over the mouth, is not going to cut it. It's just not going to do that.
I should say Public Health Ontario says they are not on holiday today, so there should be someone there, and hopefully they're watching and someone can reach out so you don't have to wait until tomorrow. Listen, keep us up to date. I know these are very trying times, and particularly with this decision that you've made, which makes it even more challenging.
Okay. I just wanted to say,
yes.
Jane Philpott has reached out, and someone is going to help us with the testing.
Okay, that's good to hear. Jane Philpott, of course, the former health minister who's returned to do some work as a doctor, because she is a trained doctor. Laura, thank you so much. I do appreciate it. It's really important part of all of this, and we appreciate you making the time for it. And Emily, thank you. Bye. Appreciate Emily.
Bye.
Bye.
Thank you so much.
Thanks for being so patient. Okay. Thanks, Laura and Emily. Take good care, all right? We're wishing for the best for you.